October 7th council meeting, one of the big items on the agenda was a council motion asking Via Rail to reverse its plans to reduce service here in Kingston, and instead to work with the city and other communities on ways to improve rail service across Eastern Ontario. Now, the motion was driven by an announcement Via made several weeks ago that they were reducing the number of trains that stop in Kingston in order to make several of their trains non-stop between Toronto and Montreal. After an outcry from Kingston and many other communities, Via announced last week that they were postponing these service changes, but that they still intended to introduce them in the future. So in response, the council motion asked Via to maintain the existing service levels here in Kingston, but also to put forward an offer to work with the city and other communities on exploring potential for service improvements. For example, adding a late evening train from Toronto to Kingston. Now, council unanimously approved the motion, and so that sets the table for putting together a community survey that will help to gather data that can demonstrate to Via the interest level in potential service improvements, such as a late evening train from Toronto. Finally, last night, council approved $400,000 specifically for helping to recruit new doctors that could replace those doctors planning to retire within the next few years. Now, the city first got involved in recruiting family doctors several years ago, after a local study found that more than 30,000 Kingston residents didn't have a family doctor. After putting several $1 million towards physician recruitment and working in tandem with a number of community and healthcare partners, the city has been able to attract a total of 33 new doctors, as well as offer grants to existing clinics to take on more patients and helping to work with other partners in launching innovative models like the Midtown Kingston Health Home. Now, council unanimously approved this funding last night. It basically will help to ensure that we can maintain the gains that we've made over the last few years and ensure that every Kingstonian can get access to the primary care they need.